As a healthcare innovation leader, it is our job to develop and deliver solutions that can provide the best quality of care without harming the planet. But we can't do this alone. That's why we've been a proud sponsor of Healthcare Without Harm's European Sustainable Healthcare Awards for several years, recognizing hospitals and individuals for their sustainability efforts in healthcare. The Sustainability Champion of the Year award winner is Evelyn Brakema of the Groene Zorg Alliantie in the Netherlands.
Hi, I'm Evelyn Brakema and I'm co-founder and chair of the Dutch Groene Zorg Alliantie, and I'm also a medical doctor and researcher. For me, sustainability in healthcare and the impact of climate and health really started with my PhD in global health, and I learned about the facts, for example, about how 1 billion people may become climate refugees if we don't change our lives. And it wasn't until I worked in a refugee camp in Greece where I really felt the impact of climate change. I was inspired to drive change in healthcare because I learned about the health paradox. So by the healthcare that I deliver, the waste, the emissions, the impact that has on the planet is also making people sick. And luckily I wasn't the only one. So around me I saw more and more nurses, doctors and so on that want to do things differently. Then we thought, what if we bring these people together and we can exchange ideas, we can inspire each other, and also we can bundle our forces so that we're stronger in advocacy.
I think what was great about the Groene Zorg Alliance is that they really pushed forward the sustainability bar, or the aim that the whole field and the whole sector put to become more sustainable. And I think that's really the work of Evelyn and the Groene Zorg Alliance. And it was really clear that their role was very respected by both the government and also the stakeholders in the sector, which was very important.
One way to share knowledge is our knowledge platform, and the green teams, they upload cool projects that they have, and they share how they did it, how much CO2 emissions they saved, and how much money they may have saved. And in this way, other healthcare professionals can learn from others and copy it easily in another city or another facility.
Healthcare produces 7% of the CO2 footprint. That's quite too much. It's comparable with the aviation. So we can and we have to do something. If you see here all the waste we are producing with disposables, etc. And I think the Groene Alliance picks up all our initiatives, for example, about wastage, about disposables, about plastics, and they can define for others how they have to work with.
And we're also very proud that we advocated for planetary health education. So now it's included in the Green Deal, which means that every curriculum for healthcare education covers planetary health.
Since education is a large part of that Green Deal, UMCs around the country have introduced planetary health into their curricula. And I work at the LUMC to help teachers and students to implement that in their education. The Dutch Groene Zorg Alliance advocates at national levels. We sat down, for example, with our Minister of Health. At the international level, we visited multiple COPs and we work together with other international organizations. And we support volunteers who advocate locally for change.
The cool thing is, one, we can exchange knowledge. So we, for example, wrote a book together about sustainable healthcare. We have a podcast, we have network events where people exchange ideas. But also we inspire each other. So we have the Green Health Festival every year. 700 healthcare professionals come there.
I think there's one key thing that the Groene Zorg Alliance does really well, and that's creating opportunities to meet like-minded people. A day full of inspiring lectures, workshops, and meaningful conversations with people who shared the same concerns and wanted to transform healthcare for the better.
One of the things that I'm super proud of is that we mobilized 10,000 of healthcare professionals. I really believe in the power of connecting all the forces that work towards sustainability in healthcare. We've done so nationally, and I think there's also a big opportunity internationally, like Healthcare Without Harm does. And this award is such a great recognition for all the doctors, nurses, physiotherapists, everyone working in healthcare that's working super hard to drive change. So we're super proud of that.
Evelyn is really a champion of green healthcare, and if you look really closely when you work together with her, you will see a hint of a green cape, suggesting she might be a superwoman.
She deserves this prize because she's a hard-working chairman of this association.
My message for other healthcare professionals would be, find each other, do it together, and don't make it too big, just start.
At Philips, sustainability is a business imperative, embedded in our operations, innovations, design, supply chain, and collaborations to deliver better care for more people. We share this firm belief with Healthcare Without Harm, our long-standing partner in driving sustainable healthcare reform worldwide. The Sustainable Project of the Year award winner is Hospital de la Santa Creu y Sant Pau in Barcelona.
I am Noé Garín. I am a clinical pharmacist and I work in the Hospital de la Santa Creu Sant Pau, which is a very big and beautiful hospital in Barcelona. We know that the environment is associated with health problems. In fact, the World Health Organization estimates that about a quarter of global deaths are related to environmental factors. So we decided that we had to do something. Because I am a pharmacist, I could do something with drugs, with medicines. Specifically, inhalers are one of the therapeutic groups with the highest impact. So our project aimed to reduce the environmental impact of inhalers. In the case of the PMDIs, a specific type of inhalers, they use a substance called hydrofluoroalkanes, and this substance have a huge carbon footprint, 1,000 to 3,000 times the equivalent compared to a molecule of CO2. We found that shifting about 50% of PMDI to other more sustainable inhalers would save up about 200,000 tons of CO2 equivalents.
So when Dr. Garín presented the project to us, we saw it like a very important and relevant project. From the clinical point of view, I think we can accomplish a better control of the disease, but also at the same time prescribing more sustainable inhalers. We have collaborated with the Ministry of Health, with other scientific societies, and also with patient associations. And we have worked together in a document. It's called the Sustainable Inhaler Prescription Document.
Our project was very comprehensive. It was divided into three main parts. The first one focused on developing a framework on sustainable prescription. Also, we created a database with all the environmental impact of inhalers. And finally, we also estimated some scenarios of potential savings of CO2. We needed to collaborate with pharmacists, also with pneumologists and specialists on environmental issues. The second part was mainly worked with hospital pharmacists, but also nurses. And the last part of the project, aiming to reduce the impact of inhalers used in the hospital, we work with the head of sustainability in the hospital, also nurses and pharmacists.
The waste that comes from medical devices and pharma components is huge. In Hospital de Sant Pau, we've been trying to promote that professionals themselves come up with ideas that we, from the boards of directors, we will support and move forward.
The role of community pharmacists is essential. They are in frequent contact with patients. They are well respected, trusted. So it's a very easy way to involve patients in environmental issues, such in this case, trying to improve the disposal of inhalers.
As a hospital, we take care of people, and caring for people means caring for society, caring for the city, and caring for the planet. We also encourage our professionals to be active in saving energy, in recycling and reducing waste. And a step forward is to include sustainability as part of our clinical protocols and even our clinical decisions. That is very important.
We are collaborating with other institutions. We have been contacted by the Ministry of Health for developing a document for sustainable prescription. Also, we have been analyzing the results of the part of the project, focusing on educating patients and specifically the results of our interventions. And finally, we are trying to implement the program of waste management of inhalers in new areas in the hospital and other hospitals. Organizations like Healthcare Without Harm Europe are essential because they provide us education, but they also help us sharing the experiences from other hospitals, other countries. We are very happy for this award. Thank you very much. It has boosted our motivation, so we want to go on trying to help to protect the environment. And we also think that sharing this experience can help others to start other projects as well.